Well, thank you for tuning back after that 2-minute commercial break. And this morning we are joined by Dr. Lycia Thornburg. And since it is American Diabetes Awareness Month, we are taking a look at how this chronic disease affects your skin. Well, first of all, thank you for joining us this morning, Doctor.
Good morning.
It's a pleasure to always have you on Wednesdays, the first Wednesday of the month and the third Wednesday of the month. So kind of talking about American Diabetes Month. We're splitting this topic into two, so you better tune in for the third Wednesday of this month. Starting off exactly, what signs? Diabetes affects more than just the health. It also affects the body's largest organ. How does that look like? What are some signs people can start looking for?
Right. There are some signs that we see as dermatologists. On your shins, you can get these coin-like lesions. They're dermopathy lesions. So those one of the signs we look for. Dark velvety patches around the neck and the skin folds. That's called acanthosis nigricans. And then a lot of skin tags that are erupting suddenly. I had a patient yesterday, and her diabetes is poorly controlled, and she's getting so many skin tags.
And I mean, just out of curiosity, kind of regarding those skin tags, are they tiny? Do they usually end up being tiny, or do they vary in size?
They can vary in size, right? But it can be a sign that they need to see their doctor to have their diabetes controlled.
And why does diabetes cause these skin conditions?
Well, it can impair your blood circulation and reduce your immune function as well, and make it slow to heal. So those are all things that can happen with diabetes.
And what is your role in kind of helping the patient work through this?
Well, it's important that they realize when I see these signs, we can talk about that they need to follow up with their doctor. Like we mentioned, we can see early signs of infections, as well as talk to them about their calluses before they break down, help them treat their wounds.
And which of these issues need urgent attention for the most part?
Right. If they have infections that seem to be spreading or redness around their feet, really diabetics really have to take good care of their feet, trim their toenails straight across, and look for any signs of redness or infection around the nails.
And here, wrapping up, one final question here is, what daily skincare steps kind of help prevent some of these skin conditions? Right.
Moisturizing daily can really help that barrier to be controlled, as well as gentle cleansers, nothing harsh, and keeping all the skin folds dry and protected.
Excellent. All right. Well, thank you, Doctor, for giving us some of the first 5 tips out of the 10 that we have this month. Thank you for joining us this morning. It's been a pleasure to talk to you.